Welcome to the HealthLink'd podcast. This podcast is for anyone studying or working in healthcare and is interested in what other health professionals do. In each episode, we will showcase and discuss a different health profession and provide insight into pathways of training, career progression, and innovation whilst working in healthcare. Thanks for listening, and I hope you enjoy the show. Alright, hello everyone. We're here on the HealthLink'd podcast with Geraldine. Geraldine is a paeds disability speech pathologist with 6 years of experience specialising in complex communication needs for children with profound disabilities. She trained overseas but has been working and living in Australia for the last 6 years. Geraldine regularly works with speech pathology students and is also sat on hiring panels for school-based education roles. Geraldine, thanks very much for coming on the podcast.
Thank you.
So, as I understand it, schools, like hospitals, have a strong component of multidisciplinary teamwork. Can you tell me about your experiences with this?
Yeah, so I work within a therapy team that includes music therapists, occupational therapist, and a physiotherapist, along with therapy assistants. And then we have the teachers as well and the educational support staff. And again, the parents are a regular component of our day-to-day work as well. So we would work quite closely with them and hand over information to them as well. So school does allow you to learn a lot from other disciplines. And also as well, it's a setting where you can see a student every single day. So it's in that aspect, it's quite rewarding work to see their progress. I know for myself, I didn't really understand what music therapy or occupational therapy was until I started in the school. So it's been really good to coordinate our goals and to share information of something that we're working on that we can incorporate in a setting. For example, with the occupational therapist, if I'm working with a child that's very sensory, I might speak to their OT and they might advise me on what kind of sensory input helps get this child ready for learning. And that in turn helps me with my communication goal.
So give me a rundown on the typical day in the life of a paeds speech pathologist. I'm interested in what's the structure of your time with the students? Do you stick to a one-on-one format or do you just kind of jump in with the classes with the teacher?
We run off a referral basis, so the teachers will refer to us. But apart from that, we're very much classroom based and helping support within the classroom and their curriculum goals. So every student will have a communication goal and we prioritise our students that we worked on based on the severity of their communication. So if, for example, if someone is non-verbal, they will be a higher priority than someone that might have just some speech sound errors. And in the school I work in, there's communication goals for every single student. So the huge part of my role is working with the teachers and assistants to help in achieving that goal. So it's very much educational and school-based. So there's other tasks that you'd be expected to be involved in since you're school-based. For example, bus duty, excursions, camps, all of the different things that happen in a day-to-day school life is also part of my job as well, because I'm hired as a school member. Instead of being a speech pathologist who services the school, I'm in the school.
Yeah, very good. So let me get this straight. If there's a school camp, you'll get along with the kids on that as well.
Yeah, it's a good thing to volunteer to go on because it is a different environment that you can see the kids in and help support communication goals in that. Looking at it being a holistic approach with the kids and that you can bring their communication resources to the camp as well and support in that setting.
A lot of these kids will have profound speech or motor impairments. But there's been a lot of innovation in some of the tools and techniques that you can use to help teach them how to communicate and also for them to learn how to communicate. And from reading around the area, I understand it's called augmentative and alternative communication techniques, or AAC. Do you use these techniques at school?
Every day, AAC is a huge part of our work at the schools. So augmentative and alternative communication can include keyword sign, it can include visuals, using communication systems, so assistive technology on iPads or on dedicated devices. So some of the vocabulary systems that I would use on a day-to-day basis include Proloquo to Go, LAMP, Word Power, and Pod.
Do you have a favourite piece of tech or a favourite strategy?
For AAC, it's very much an individualised approach, and depending on how the student's communication skills present. In each of those different vocabulary systems, it's a dynamic assessment where you would trial them for a few weeks and see how a student goes with it. Can they use it for a range of communicative functions? Can they access the keys on it? So, and also a discussion with parents and teachers and educational support staff as well to get their feedback into the use of the AAC system. So it's a dynamic process. AAC in particular has massively changed even from when I first saw my first device. So I think how smaller they are and how accessible and the speed that they operate. So the main aim of alternative and augmentative communication is that I have spontaneous communication as quickly as possible. The first device I had ever seen, and this was only about 10 years ago, was the size of a small suitcase. Yeah. So now they're much more accessible, much more smaller, and run at a much faster pace, and most of the time are much more easier to program.
And can the students take them home with them, or is it just in school that you use it?
In school, we have communication iPads where we trial each of those systems, each of those vocabulary systems, and they don't bring those home. But we can apply and do trials where we can send the equipment home from external companies, and then the students that own their devices bring their devices to and from the school.
Give some specifics around that. That's children who have cerebral palsy, children with Down syndrome. Are there any other ones?
Children who have autism, children who have been diagnosed with developmental delays, and children who may have a range of genetic disorders.
Do you ever send a student away for video fluoroscopy?
Because I work with kids that have complex disabilities, so this impacts on the development of a functional swallow.
Yep.
And that's why we would refer to video fluoroscopies, just so we could see how they are. So we have some students that have CP, and if they have difficulties with their big body and muscle functioning, they're going to have the same with their eating and drinking, and may have some difficulties with their safety around that. So video fluoroscopy provides us with a clear picture with what's happening. It's pretty much an X-ray from side on as the person is having a piece of food or taking a drink.
So if someone who is just out of uni is interested in training in paeds disability, would you recommend going into a private practice role or a school-based role just to get the best training?
I think that's very much dependent on the level of mentoring that you can get. For a new graduate speech pathologist, it's a complex setting to be working in, given that there can be a lot of behaviours or high stress. If it is private practice, it's usually tends to be early days as well. So it's all around the time of diagnosis as well too. So it really depends on the level of mentoringship that is provided, and it's something that you need to ask and be open about.
Or what would you recommend be the minimum amount of one-to-one mentoring that someone new to the area gets, say, in their first 6 months?
For a new graduate, an hour a week. But apart from that, I think it'd be important to be proactive with your own learning as well, and ask as many questions of those that are around you. I know for myself, I had almost 4 years experience before I went into my current role, and I learned so much from the teachers and teacher assistants where I work. So it's also looking at people from other disciplines. I learned from the OTs that I work with, the occupational therapists and the physiotherapists. So yeah, it's seeking information from any source you can within the workplace to help improve your own clinical skills.
You also mentioned that you sat in a few interview panels for speech pathology. Can you give some specific interview tips for candidates?
I think the main thing in an interview is to take your time. It's the most important part of it, because that's your opportunity to sell yourself. You've made it that far because of your skills that were based on paper, and now it's your time to think about each question before you answer it, because more often than not, someone has not given the information or not exactly answered the question. And it does come down to nerves on the day, but research your setting and run over and practice answering some of the questions that you know that will come up. For example, in my setting, I knew that AAC would definitely come up, and some form of question on behaviours as well, and working with the teachers. So I practiced answers of those before the interview.
And how about any specific tips? Something they can practice?
Practice answering questions out loud. Get someone to role play with you, maybe ask you a few questions. Write down some things that you want to talk about. And during the interview as well, take the opportunity to write some notes also, if that helps you with remembering information.
I know one good tip that I picked up is, definitely pausing an interview and planning your answer, because it's easy to just start blurting immediately. Have you ever seen anyone kind of do that during an interview?
Not really, because speech pathologists tend to have quite good communication skills verbally and written communication skills, as it's an essential of the job, but it's also with things nerves can definitely impact. Okay. So just take a minute to ask for the question to be repeated, rephrased, and just be honest in the interview as well too. Lots of practice. It gets easier the more you practice doing these.
Yeah, sure. So all speech pathologists interview perfectly every time?
I guess so, yeah.
It's good to hear. I want to step back, because I know you often have students that come to you and work at your school with you. Do you have any tips for students preparing for their placement?
I think just giving everything a go on your placement and trying to learn and showing that you're being proactive as possible is the biggest thing I've noticed with students.
Well, brilliant. That's been very informative, and thanks very much for coming on the pod today.
Thank you.
And that's it. That's the end of today's episode. Thanks so much for listening. I hope you enjoyed the show. If you're interested in any other aspects of the HealthLink'd podcast, why not hit us up on Facebook? Hit join and join in all the regular discussions to be found there. Thanks again. See you next time.